Let's talk about knee injury just for a minute. There are several structures inside the knee joint that can be injured. Ligaments, specifically the anterior cruciate ligament, what we also know is the ACL, the meniscus, and articular cartilage. With respect to the ACL, can you tell us what's the function of the ACL and how does it get injured in basketball players?
So the ACL is a ligament that connects the femur or the thigh bone to the tibia, and it really functions as the primary stabilizer of the knee. It's the most, besides a ligament on the inner side of the knee called the medial or intercollateral ligament, which rarely requires surgery if it's torn, but is a very common injury. The ACL is probably the second most common injury and very common in basketball. And in basketball, it typically occurs as a non-contact, but at the time a player is actually in competition or in more than a one-on-one situation. In other words, it's very rare for a basketball player to tear his ACL unless he or she is actually competing against another individual. And it's probably has something to do with the timing issue where their brain is not entirely connected perfectly well, or they may have some rehab issues that are somewhat or minorly deficient that lead to a misstep, and it's often a non-contact, but again, in the heat of battle, where they're jumping up or coming down or running, stopping, pivoting, and the tibia or the shin bone goes one way and the femur goes another way, and it tears the central ligament in the knee. And subsequent to that, it's not uncommon for the knee to swell and for the individual to have difficulty, at least initially, bearing weight on the joint, although that quickly resolves. And basically what they're left with is a knee that's unstable, or they get a sense of giving way, especially with activities requiring acceleration and deceleration.
And what about the meniscus? What's the function of the meniscus in the knee joint, and is it injured in a similar way to the ACL?
Yes, so the meniscus is, there are two types of cartilage in the knee. One is the meniscus cartilage, which is a soft C-shaped cartilage that is interposed between the femur or the end of the thigh bone and the tibia or the shin bone. And then there's the articular cartilage, which is the hard cartilage, sort of the white lining that one might see at the end of a chicken bone. And they work together in concert to provide a smooth, gliding surface that's pain-free. So the meniscus is not uncommonly torn, for example. At the same time, there's an ACL tear. And patients may or may not have cartilage or articular cartilage injuries at the same time, or those may develop over time in what we call degenerative capacity.